In today's health headlines, what to know about chemotherapy. Is it being replaced with immunotherapy? And how often does cancer get detected during treatment for other conditions? Joining me is Dr. Elena Ratner, gynecologic oncologist and co-chief of the gynecologic oncology section at Yale Cancer Center. Welcome to you.
Good morning. Thank you for having me.
You bet. All right, chemotherapy is in the news recently. What exactly is chemotherapy and how does it work to treat cancer?
So chemotherapy is a broad term. It is part of the treatments that we use to try to kill the cancer or prevent the cancer from coming back. Nowadays chemotherapy is such a bigger concept because so much of what we do now is personalized therapy and targeted therapies that is intended specifically to target specifically the patient's cancer cells. And chemotherapy, as part of it, is supposed to kill the cancer cells.
All right, immunotherapy is a treatment option for certain cancers, but is it going to replace chemotherapy? And what types of cancers can you use it for?
Excellent question. So immunotherapy is an example, a perfect example of what I was mentioning before, which is a targeted therapy, which is a specific therapy intended to target the patient's specific genes, specific mutations that are causing the cancer or propagating the cancer. Immunotherapy has been life-changing in diseases like melanomas, cervical cancer. It very much changed the landscape of this disease and has become curative for a lot of cancers. But it's one of many examples like these where we are learning how to attack these cancers better and differently, and not just with plain chemotherapy, how we used to do it in the past.
Is this easier on the patient than chemotherapy?
For sure. So immunotherapy, just like many other of these targeted options, has been so amazing because not only are they more effective in beating the cancer, but even more importantly, or as importantly, they're much less toxic, and they give the patient, or the woman in my case, so much less toxicity and side effects, and really allows them to live their normal lives.
That's so terrific. All right, this happens all the time. Discovering cancer during other procedures is unfortunately common. What can you tell us about this? I mean, you go in for one thing, they image, and you find cancer.
Unfortunately, that is so the case. And what happened with Princess Catherine is so sad, but it's actually also good because it's giving us a view and the importance of education and advocacy, how something like this could happen. And for sure, in all kinds of different cancers, particularly in gynecologic cancers that I take care of, frequently, or not that frequently, but occasionally, we find cancers when we don't expect them. Very frequently, you do take somebody for surgery with a mass that you do not know whether it's going to come out to be a cancer or not. Many times, you're able to look at the tumor during the surgery, something called frozen section, where you are able, with quite high accuracy, be able to give a diagnosis at that moment. But sometimes, and many times, that is not possible during surgery, and you only discover cancer cells subsequently when the final pathology is done.
Love hearing these new breakthroughs. Dr. Elena Ratner, thanks so much for being with us today. I appreciate it.